So welcome you all to the webinar. I really appreciate all your time in joining the call on your busy schedule. So we have multiple participants joining the call. So we have Shama joined the call, Samuel Jabraj, Hema, Karthikeyan have joined the call. So we have Mahabub in the call. We have Murthy Krish. Welcome you all, sir. Welcome you all team. So now we have Surya Jahari also joined the call. I hope my voice is audible. Can you someone post me that like you can hear me or not in the question and answer session? Can you post your comments in the chat session? Whether you're able to hear me? Great. Thanks, Samuel. Thanks for your answers. So let's wait for another 5 minutes. Let all the participants join the call. Then we can proceed. So we can start the webinar by 4:05. So we are getting many new participants here. We have Jeremy here. Welcome, Jeremy. Welcome to the webinar. So we have a new participant here. We have Dinesh have joined the call. Welcome you to the webinar, Mr. Dinesh. Let's wait for another 2 minutes. Then we can start the webinar. We have Jagdish in call. Welcome, Jagdish. Okay, it's time. So let's get into the webinar. So I'll share my screen now. Can you all able to see my screen? Can you see the presentation? So let's start with the webinar. So once again, welcome you all to the webinar on the topic, how healthcare CMS helps the hospital with facility maintenance and the patient care. So before walking you through the presentation, I'd like to share a small experience that I had with one of the surgeon in Coimbatore. His name is Dr. Hariharan. He's a neurosurgeon. So I had an opportunity to talk with him last year. So that time he was explaining me. So whenever he's entering into an hospital, especially entering into an operation theater, he feels like entering into a war field. And he was introducing his team, the staff members, biomedical engineers, as in warriors who helps him in the war. So as he rightly said, like if you all are the warriors, then we have a tool that helps you to win every war that you're attending. That is CMMS, a computerized maintenance management system which benefits all the hospitals in maintaining their facilities and to automate their maintenance activities. So not only the hospitals, also like if you are a company that's selling biomedical equipments to the hospitals, then in order to track your field service technicians work order, then it will be more helpful for you as well. So this is me, Muthu. I'll be the host for the day. So I work here for past 2 years, helping multiple industry verticals in order to improve their maintenance activities using CMMS. Today, I'll give you more insights like how the CMS will be helpful in the healthcare industry. So this will be the agenda of the webinar. So I'll start with an introduction. I'll walk you through what all the challenges faced in the healthcare sector and how important is to maintain the facilities in the healthcare sector, and how the healthcare will be with and without CMS, and what are the benefits you'll be getting out of healthcare CMS, and what are the key points that you have to consider before implementing any CMS into your hospital. And I'll walk you through the live demo of our application, and we can discuss on some case studies. And I'll conclude this webinar within 30 to 40 minutes of time maximum. Then we can have a question and answer session, and I'll end up this webinar. So before starting with the presentation, let me understand like who all I have joined. So what is your position in your hospital? Whether you're an hospital administrator, facility manager, biomedical engineer, or a student like who want to know more about CMMS. Kindly post your answers in the chat box. I'll read it. So we have Nagav as a facility manager here. Let's wait for some time for the other answers as well. So we have Karthik from biomedical team. We have Ali as a facility manager here. So we have Somo as an hospital administrator here. So thanks for all your answers. I really appreciate it. So whoever you are, whether you're an hospital administrator, facility manager, biomedical engineer, or a student like who want to know more about CMS, then you are in the right place. So without any further delay, let's dive into the fascinating world of CMS in the healthcare. So let me start with an introduction. So as we all know, healthcare industry is a very critical industry where the patient care and safety are at most importance. Imagine in a ER room, a casualty is coming in, a doctor is asking for an artificial defibrillator. But if it is not working on that particular time, it is bad, right? Or like imagine, like you have a BP machine or a glucometer which is not calibrated properly, giving you wrong results. For a non-sugar patient, it is saying that you have an excess sugar and he start taking the medication, it may also lead to the life of a risk of a patient, right? So the patient life is not only the responsibility of the doctors, it is also the responsibility of the biomedical engineers, facility managers, and also the infection control team. It's a teamwork. So now let's see like what all the challenges faced in the healthcare sector. The first and foremost is equipment breakdown. Any breakdown related to the critical asset is not acceptable in the healthcare sector. Especially in order to maintain uptime for any critical asset is not that easy. It's very tough. That is very challenging in the healthcare sector. And there are many regulatory compliances that you have to follow in order to get in standards, accreditations, or like for the certification, which given by the joint board commissions. And the workforce, workforce, the staff members all feel like they are overloaded with the work, especially the biomedical engineers. So they spend more time on working on the breakdown, so they doesn't have much time in doing the preventive, which again leads to them the breakdown. So they feel like they are overloaded with the work. So that is another challenge I could highlight you here. And as we all know, we all have an budget. Limited budgets will be given to every department in the hospital. So budget constraints is another challenge, and maintaining the assets. So when it is healthcare industry, especially in the hospitals, from the small needle to the big machine, everything is considered as an asset here. There will be thousands of assets which has to be maintained. So that is another challenge here. And the staff training. Whenever so the statistics says like most of the breakdown happens because of the poor staff training. So that is another challenge, which leads to the breakdown, which reduces the downtime of that particular machine. So that's another challenge. Every hospital will be facing it, and we all know there are many contagious diseases that can be easily spread. Like if there is no proper infection control is not there, so that's another challenge here. Maintaining the infection control is not easy, and emergency preparedness. If there's any casualty coming in, all the life-saving assets like ventilators or like artificial defibrillators all has to be very kept very ready. So if it is not working on that particular time, then it is tough. So these are the basic challenges that like every healthcare sector will be facing every day. So next we'll discuss on the importance, why it is very important to maintain the facilities in the healthcare. So when it comes to the facilities, like we can divide it into, it can be either hard services or like the soft services that you have to do in order to keep the environment clean and safe. So when I mean hard services, all your MEP works, the mechanical work, electrical work, plumbing works. So they are all considered as an hard services here. And when it comes to the soft service, all your housekeeping works, especially where the infection control team comes into the picture. So the proper housekeeping works that has to be done every day. So there are many compliances with the regulatory requirements that is essential in order to maintain the quality and safety of an environment in the hospital. So there are many NABH standards and Joint Commission boards. They have multiple regulatory compliances that has to be maintained. So even the World Health Organization formally recommends the usage of CMS in the hospital. So they have found in their research that CMS has more impact in the healthcare industry comparatively with the other industry verticals. So now it's time for a poll question. So I'm posting the poll question with you now. So how much you are aware of CMS? Whether you are well versed and you are already using it in your hospital, or like you know the concept but you have never used it, or like you know little bit. or like he doesn't know anything about CMS. So we are getting multiple votes here. So 60% knows little bit. The value keep changing. So I'll publish the results. So 10% said like they are well versed with the CMS already and they are using it. And some may have mentioned like 20% have mentioned that they know the concept but they didn't have a chance to use it. And 60% says like they know little bit about the CMS, and 10% says like they doesn't know anything about CMS. No problem. So after this webinar, like you'll be having a 10% idea about like how CMS will be helpful in the healthcare industry. So now let's discuss like how the healthcare will be with and without CMS. So without CMS, the maintenance approach will be literally tough. You have to be reactive. Like after the complaint happens, like the biomedical engineer has to go and he have to rectify a particular problem. But like if you have a CMS with you, you'll be doing proper preventive maintenance. While doing the preventive maintenance itself, like you can address every breakdown at the budding stage itself, and all your ppm will be automated, ppm tasks will be automated, which will be eliminating all the issues that are happening inside the premises. So next will be the regulatory compliances. So as I already told you, there are many joint commission boards will be there, NABH standards that you have to follow in order to get an accreditation and certification. It is if you are not using an CMS with you, like every work has to be done in the paperwork. So while during the auditing purpose, like if they found like you have not done any auditing work properly, then it is very risky, right? So it may be even they may even fine give you potential fines, and they also risk in the reputation as well. So but like if you have a CMS with you, like it shapes all your maintenance activities according to the regulatory guidelines, and you can also document what all the work that you have done for that particular asset. So if you have a CMS, it will be more effective. Your maintenance activities will be more effective. And if you don't have a CMS with you, then the maintenance management decision will be tough. So, for an example, if the doctor is asking, or the biomedical engineering head asking for a report of a particular asset, so then you have to, for an example, take an ultrasound. So you have to take multiple files with you. You have to check like whether you have done the preventive maintenance at monthly or quarterly, like this. Like you have to take multiple files, multiple pages. You have to refer in order to find what all the works that you have done for that particular work order. It's tough, right? But if you have a CMS with you, just scan the QR code, boom, all the data will be in your fingertip. So the data driven out of the proper work order will helps you to understand like what all the utilities you'll be needing in the future. Like spare forecasting will be more easier here, where like you can manage how much spare you'll be needing in the next year. That spare forecasting will be more easy, and decision making, or whether I should have this particular asset, uh, whether I should have this particular asset, or like whether I have to move it to the scrap. The details all I can have a track if I have a CMS with me. And the next will be the asset visibility. So if it doesn't have one CMS with you, there will be a poor visibility of assets, like misplaced of any equipments with different departments. It may create multiple confusions with you. There won't be a proper planning for the task, because like it doesn't know like where exactly that particular asset is located at. But like if you have a CMS with you, real-time visibility into the asset status, you can have a track here. So where exactly that particular asset is located, that you can have a track here. So in detail, like we can see in the upcoming slides, like how you can track your assets internally. So internal assets tracking with multiple technologies like BLE, RFID, and QR code, you can do it. So these all the sensors that you will be providing you, so that can be fitted into that particular asset. So whenever there is an whenever you want to track that particular asset, where exactly it is located at, that entry and exit points can be tracked here, so that you can easily identify where exactly that particular asset is located at. Especially RFID tags will be more helpful for you in that auditing purpose. Imagine like you have thousands of assets in the hospital, especially into the operation theater itself, like you'll be having hundreds of assets. So for auditing purpose, like if you're doing it in the paperwork, there is a chance that like you can may miss any assets while doing the auditing purpose. But if you have an RFID with you, RFID tags installed in that particular asset, so with the RFID handheld calculator, with just clicking on one button, I can get all the details about that particular asset. What all the assets is located within that particular room, I can audit it and I can easily move on. So this is the one point. So the next, it will be the interactive assets, the interactive asset floor plan. So where all your work floor plans can be incorporated here, and according to your floor plan, like you can also mention where exactly that particular asset is located at, and you can know the status of that particular asset with multiple different color codes. So if it is in red, you can see on this particular place, this particular asset is in breakdown. Like that, you can understand. So if it is green, like it is ready to go, and if it is in blue, and then it is under the preventive maintenance task. So like this, like with the different color codes, you can track your work orders with a floor plan. So next will be the IoT based energy management. So we'll be providing you IoT sensors here. So this IoT sensors will be fixed with an energy management energy meters that you have in the hospitals. So by sitting in the home, you can track the live data, what is happening with that particular energy meter, how much it is consuming. That tracking all you can do it based on the any critical point. If you want to do the conditional monitoring activities, that also can be done if you have an IoT with you. And the research says 40 to 60% of HVAC system consumption have been reduced because of the IoT used in the hospitals. So now it's time for the questions. So let me understand, like, what is the current technology that you are using now in order to maintain your critical medical assets? So kindly post all your answers in the comment section. Let me read it. So whether you have using an HMS with a HMS handbook or Excel or CMS, or like you have an IT artificial intelligence already incorporated with your CMS, kindly please answer it. So we can see Somo is using Excel. So Samuel is also using Excel to maintain his critical assets. So we have Naga, and Naga is also using HMS. Thanks for your answers. Whichever the software that you are using it now, I'll also help you to understand like how this healthcare CMS will be more effective than the software that you are using as of now. So for the persons like you are using paperwork or the Excel sheet, it will be more helpful for you in automating and digitalizing all your maintenance activities here. So we have already discussed most of the benefits of the healthcare CMS. Now I would like to summarize all the points here. The first point will be improved maintenance planning and scheduling. So all your work orders will be streamlined properly. You'll be doing the preventive maintenance properly, and there will be a reduction of breakdown. Uptime will be higher, and enhanced asset management. No assets will be missed out from your eyes. So you can see like from the small little to the big machines that you have, everything will be under your track. And next, it will be the increased compliances and safety. In order to get an accreditation and certification, it will be more useful if you have a CMS with you. And the better cost management, you can forecast how much spare you will be needing it. That forecast you can do it. Return of investment for that particular machine will be high because the uptime of that particular machine will be high. So the next, enhanced communication and collaboration will be within your workforce. So they will be well aware that like what all work have been assigned to them on that particular day, how much work orders that they have to do it. Everything will be transparent. So it will be very easy for them to work on their regular basis. So these are the some benefits that I would like to highlight here. And what are the key points that you have to consider before implementing any healthcare CMS into your hospital? The first point, you have to define the goals and objectives. So what is the exact goal? Maintaining, automating all your maintenance activity will be the goal. And asset management, maintaining all your assets uptime, that is another goal. So like this, like you have to define the goal and objective. So what is the exact goal of your hospital, that your requirement, that you have to define it. Then you have to choose the right CMS. So there are many CMS in the market, and you can find like which CMS best suitable for the workflow that you are already following it existing in your existing hospital. so that you can choose the right one. Then you involve all the stakeholders. When I mean stakeholders, the head of all the departments in the hospitals. So all can be involved here. So they can also, so the particular CMS should be suitable for all the departments, not only for the biomedical engineers, also to the facility managers. It has to be easy for them to access the CMS. So you have to involve all the stakeholders before implementing any CMS here. So let's dive into the live demo application. So I'll start sharing my screen with you now. So this is our product, InnoMate, innovative maintenance. In short, like we call it as InnoMate. And this is our product, Healthcare CMS 4.2. 4.0 here denotes the Industrial Revolution 4.2, which means like every process has to be automated. Basically, it is a cloud-based software. You can access it in both web portal, also like you can access it in the mobile phone application. So you'll be provided with a mobile phone application, which will be supporting in both Android as well as in the Apple phones. So once you're onboarded, like you'll be provided with the login credentials. Once you logged in, it will be redirecting you to this dashboard page. So this is how the super admin dashboard looks like. This is for the management purpose. So they can see a very good dashboard, which gives the overall overview about all the maintenance activities happening inside the premises. So if you are an healthcare industry, like where like you are supplying assets to the hospitals, then in order to track your field service technicians and their work orders also, you can track it using this application. So this is how like their dashboards also looks like. So you can see like how much preventive you have planned for that particular customer, or like for that particular hospital, like inside the premises, how much preventive they have planned, how much their team have started working on it, and how much pending works they have. That details all they can have a track here. And the same they can do it for the breakdown as well. And they all given with multiple filter option, where if I want to know like what is happening with that particular department alone, or like I want to know like what is happening with my unit 1 alone, or like I want to know what is happening with that particular customer alone, like this, like you have a multiple filter option where like can filter and you can take the reports accordingly. So you for the management purpose, it will be also provided with this particular chart, where they can see like how much preventive have been created and how much their team have completed it, that they can have a track here. So when this both bots are in the same line, they can consider that they are getting an 100% productivity from their team. In that way they can assume it. So the same they can do it for the breakdown as is completed as well. And they can also compare and see the higher the preventive, lower the breakdown. That comparison also they can have a look at here. So before walking you through the remaining dashboards, let me start with a basic configuration, like what all the data you'll be needing it to set up a particular software. The first thing will be the users. So who all your workforce all can be added here. Different user roles you'll be following in, and different hierarchy you'll be following in your premises, right? So that can be incorporated here. So according to the user role, the access for the application differs. So once the users are added, then you can add the location here. So how many locations you have, that master can be added here. How many buildings you have, that mastery can be added here. And floors and rooms also, you can add the masters here, which will be later helpful for you in mapping that particular asset with that particular location. So now I'll show you a sample how you can add an asset. So we have a bulk upload option as well, where the Excel template will be given with you, so you can fill the data. So thousands of data can be pulled into the software in a single shot. So that option is also available with us. Or like you can also add it manually. I'll show you like how to add the asset manually. For an example, I'll take an ultrasound as an example here. Ultrasound machine. So this is how like you'll be adding an asset here. So when I mean assets, it's not only the equipments, also the facilities also consider as an asset here. So now I'll show you like how you'll be adding a machine or an equipment in the software. You can when you're adding it manually, these are the questions it will be asking you. Like the basic OEM details can be added here. You can club all the categories into one. For an example, biomedical assets all can be clubbed into one. Electrical assets all come clubbed into one. Furniture assets all can be clubbed into one. According to the categories that you're following now, that can be added here. And what is the asset name, asset model? What is the depreciation model that you're following for that particular asset? That can be incorporated here. and what are the sub assets you have related to that particular asset. For an example, if it is an ultrasound, you will be having probes as a sub assets, right? So that probes also can be added here, and spares related to that particular assets can be maintained here. For an example, like you'll be having gels for gels as a spare for ultrasound, right? That can be added here, and any documents related to that particular asset can be added here. For an example, user guide manual, troubleshooting guide, installation report, PO. So any documents related to that particular asset can be added here, and you can mention like what all the possible defects that can happen for that particular asset, that you can list it out here. So which will be later helpful for your team whenever they're raising a complaint. They can choose that from the drop down section. So the next will be the solution bank section, where it is more like an history card for a particular asset. So what all the problem occurred earlier, and what is the root cause found by the team, and what is the solution they have given for that particular complaint. That track all will be coming here. So for an example, a problem is occurring today. The same problem is occurring after a year, but the same service technician is not available with you. Then just by referring this solution bank, you can suggest the new service technician what can be the possible solution. So even your biomedical engineers are leaving the company, their idea remains back in the company. That's why like we have this option here. And any additional information related to that particular asset, specifications that you want to add it, you can add it here. And if there is any critical point that you are monitoring, for an example, in the ultrasound, after 10 cases I have to change the gel, or like after 100 cases I have to change the probe. In that case, like if there's any critical point that you are monitoring, based on that critical point, like if there's any schedule that you want to create, that also can be created here. So I'll show you sample schedule, like how it will be created. So this is how like the schedule will be created. You can add the schedule name here, and how frequently this particular schedule has to come, whether it's based on the calendar ad hoc, or like it's going to be based on the monitoring point, that you can define it here. And you can define the frequency, how frequently this particular asset has to come, whether it's a daily task, monthly task, or yearly task, that you can define it here. So based on the frequency that you have set it up here, you can also add what all the tasks that you have to add it here. So inspection task you can add it, monitoring task you can add it. If there is any calibration task that you want to do it for the BP machines, BP machines, and some machines like which all has to be calibrated, that calibration tasks you can add it here. And review task you can add it here. And any approval task that you want to have it after the task is completed, like the series of person has to approve it. In that case, like that approval task also can be added here. And any spare replacement task, if you want to add it also, you can add it here. Which where like after 3 months, like every, for an example, you have an AC, like every 3 months you want to change the filter for that particular asset, that you can define it here. So automatically system will be alerting you that we have a schedule that you have to do it. So once the schedule is created and initiated, it will be reflecting in the work order section. We have both options, like auto assign option is also available, and manual assigning also can be done. So once you assign it, the service technician will be receiving it in the mobile phone, and he will start working on the work order. So once he executed the work order, it will be coming to the in progress section, where the senior person has to approve it. Once he approved it, it will be moving to the close section. So once they completed the work order, you can take a very good report out of it. I'll show you a sample report here. So here you can see, so this is how like the sample report will be. Instead here, your company logo can be replaced, your company address can be added here, and schedule details will be there, asset details will be there, checklist details will be there, and what is the comment given by that particular service technician, that detail will be there. If you have added any images for the proof of evidence before task and after task, that images also will be coming here along with date and time, and who is the person attended that particular ticket, his details will be there, and when he checked in, when he checked out, and who is the person acknowledged it, and who is the person approved it, all their signatures will be coming here. So this is how like they'll be completing the preventive maintenance. So the next will be the breakdown, which will be similar to the preventive maintenance. So if you are using a mobile phone application to raise any complaint, so QR code will be created for every assets that you are adding into the system. So this is how like the QR code, sample QR code looks like. So it will be having the hospital name, what is the machine, and what is the asset ID, that detail will be there. So if you scan this QR code, it will be taking you to this form page, where like you can fill all the forms here. So automatically, if you by selecting the asset ID, automatically other data all will be fetched. Same like that. Like if you scan the QR code, automatically this data all will be filled. So you can just mention like what is the status of that particular complaint, what is the defect they found, and what is the severity of that particular complaint. And if you want to add any images for the proof of evidence, he can add it. Videos, audios also can be added here. So once he created the ticket, same like preventive, it will be coming to the new section where like it will be assigned to that particular person. So he will be receiving it in the mobile phone. Once he completed it, it will be coming for the approval section where the senior person will be approving it. If he's happy, he can acknowledge it, or like if he's not happy, he can reopen it at any time. So once he approved it, it will be moving to the close section where we can take a very good report out of it. So this is the sample report of the breakdown service report. So instead of this particular logo, your company logo will be there, ticket details will be there, location details will be there, asset details will be there, and who is the engineer attended, his details will be there, and what is the root cause they found, what is the solution they have given, and what is the problem they found, and how they rectified the details, all you will be having it here, and who acknowledged it, whether they have consumed a spare or not, how much they are spending on the spare, and before task and after task, if there is any images that they have added, that details all you can have a track here. So once it is completed, then you can also see the approval. Who is the person approved it? His e-signature also will be coming here along with the comments that he left. So this is how like you will be completing the preventive and breakdown here. So after completing it, like you can also have an track of the spares as well. So how much spare you have in the hospital, or like if you are in a company, like how much spare you have in the inventory section. So that track you can have it here. So this is how like you can add the mastery of the spares here. You can categorize your spares according to it. Like consumables all can be categorized into one, spares all can categorized into one. So like this, you can categorize it, and you can also set it up on minimum reorder level. So whenever it reaches the minimum reorder level, automatically your procurement team will be notified that this particular spare have reached the reorder level. Kindly reorder it. In that way, it will be notifying you. So these are the advantages you will be getting it here. And we do have multiple report section where like you can take on multiple reports. So in the transactional reports, you can get the schedule details, ticket details, and spare details, how much spare they're consuming it. The details all you can have it. And spare forecasting also can be done using our software. And we also have this multiple filter option where like you can filter according to your need, and you can take the reports accordingly. And once the report is created, it can be generated in either Excel or like PDF if you can export it at any time. The same you can do it for the other reports as well. So the monitoring report, any critical point that you are tracking, that detail will be coming here, and the performance report. So performance report. So it will be having the engineer performance on the tickets and on the engineer performance on the schedule, and what is the performance of that particular asset, what is the MTTR value and MTBF value. So MTTR is nothing but of the mean time for the recovery, and MTBF is nothing but of mean time between two failures. So the uptime, downtime, everything you can calculate it. That all will be coming in the report section, which can be exported in either Excel or like PDF at any time. You can do it. And you can also have a track of asset report, like how much assets are in live, how much have been moved to the scrap, that details you can have a track here. How much stocks you have in the inventory, that you can have a track here. And how much it has been consumed, that spare usage report, you can get it here. And if there's any movement happening, like inside the premises, or like we are going, that particular asset going out for the services, that asset tracking all can be done. That move management track report also will be tracked here. And attendance report, we have a small attendance report here where like you can track if you're on a company selling equipments to the hospitals, then you can track your field service technician. The live tracking of the field service technician can be done, and when they punched in, when they punched out, that tracking all can be done in the asset report. And we have this asset depreciation report where like you can have a track of the value of that particular asset. What is the purchase value, and what is the current value of that particular asset, whether it have reached the salvage value, whether I have to move it to the scrap or not. That all you can do it with this report section. So the next I can highlight you is the calendar and scheduler part. So in the calendars, like this is for the management purpose, like where they can see the report. So where they can see the calendar view, who all the person working in the field, and what is the work they are doing it as of now. The work orders with the different color codes, you can have a track here. The same if you want to track on a particular service technician or biomedical engineer, then he can also do it by selecting the scheduler part, where he can have a track of that particular service technician. So how much work he have completed, how much pending works he have with the color codes, you can have a track here. So this is a quick overview about the softwares that we have, and we do have multiple options. So I'll explain you all the technical demo will be given after this session. Like if you are interested, we can proceed further. So let's discuss some of the case studies. So where like our healthcare CMS is implemented. So this is the real life examples. So we have this company called Dublin in Dubai. So they are a group of companies under which they have one Seha Emirates Hospital. So in this hospital, they are currently now using our CMS, healthcare CMS, in order to automate all their maintenance activities. So before coming to us, they were doing every works in the paperwork manually. Everybody is writing it, and some of their departments using Excel sheet. So they said like maintaining the biomedical equipments are really tough for them. Even like after every year, like when they're doing auditing, they find like many assets are even missing. So to track their assets and to track their PPM activities, they are missing many PPM activities because they are doing it manually. So these are the pain points that they given to us. Now after implementing the CMS into their company. So in the hospital, now all their work orders have been streamlined properly. So all the preventive are done and properly. Imagine like for a particular asset, for an example, ultrasound, they have a different checklist followed. For a daily frequency, they have a different checklist. For monthly, they have a different checklist. For yearly, they have different checklist. Just for a single mission, they have multiple checklists for with multiple frequencies. Then imagine thousands of assets. So that is what they are facing a difficulty over there. But now all their work orders are streamlined using our software. The whole work order is streamlined and automated. So whenever they have a PPM for that particular machine, automatically the system will be alerting them. So the workforce also very happy that they are very clear like what is the work that they have to do it on that particular day. So it was very transparent for them to work on it. So these are the benefits that they are getting out of CMS. So they said like after using it for a year, now they have said their breakdown have come 20% have reduced because of using a CMS because they are doing the proper preventive maintenance. So and what are the results that they are getting out of this particular CMS is like increased asset life cycle, a return of investment of that particular machine because the uptime is high and lesser the breakdown happening. So the uptime was high, so they have a very good asset life cycle and reduced asset downtime because of the proper preventive maintenance happening over here and effective use of their workforce. Before the workforce was only working on the breakdowns, but now they are working on the preventive maintenance on time. So where the breakdown have been reduced. So these are the benefits they are getting out of this EMS. So the next example which I can highlight you is the Baxter company. So you all must know well aware about Baxter company. It's a Fortune 500 company in the medical line. So they are using this particular software in order to maintain their facilities. So imagine, so they said like what is the pain point that they were bringing it to us is so they are on a particular day like 5,000 employees will be checking in every day and they have 3,000 housekeeping workers alone who is doing the work orders every day. So they said like to streamline all their work orders is very tough for them because they are doing it everything manually, and after a few days like they were using it in Excel, still they find it is very tough to do it. So like they come to us with their pain points. Now what is the solution that we have given is, so we help them to automate all their maintenance activities, like all the preventive maintenance, all will be given. So rising of the complaints is very tough. They doesn't know like who raised the complaint, when it is raised, whether it have been completed or not. That was very difficult for them to track it. But now after the CMS comes in, they have a clear picture like who raised the complaint, whether that particular complaint have been resolved or not. And they also have mentioned that they have attained an 21 CFR Part 11 solution, which will be given only for the person like who automated their housekeeping works, and their housekeeping workers also are very happy when they're using the CMS, because they know like what is the work orders they have to do it on that particular thing. And anyone can raise the complaints in their using the mobile phone application. They'll be just the QR code will be sticked with every facilities over there. So just by scanning the QR code, the anyone can raise a complaint. So the complaint raising system was very easy for them after using an Inomate CMS with them. So let me conclude this webinar with some of the summary. Let me summarize like what all the points we have checked here now. So the first, the problems with outdated manual methods. So it will be a reduced uptime. The uptime of any critical assets will be very low if it doesn't have a CMS with you, and inefficient work order management. Complaints challenges will be there, and cost will be high because you will be keep addressing the breakdown. You will be consuming more space, which gives you more cost. Incurring of more cost will be done if you are doing it a paper system or an Excel sheet. But if you haven't CMS implemented in your hospital, then the maintenance operation will be very good, and increasing the asset visibility, and it will be optimizing your preventive maintenance will be easy. Streamline your work orders will be very easy, and ensure that all the work orders are under compliances, falls under the compliances. Auditing purpose all comes under the compliances, whether we are following the proper standard regulatory compliances in order to get in certification, and making a decision out of the data that is driven in real time. So these all the benefits that you will be getting it in the CMMS, healthcare CMS, if you have it in the hospital. So now it's time for the question and answer session. I hope like I have given you a brief detail about like how CMS will be helpful in the healthcare industry. So kindly post all your questions here. I'll address you like what are the problems that you are facing in your system. So please post your comments. So we have a question from Jagdish, Mr. Jagdish. Can schedule can be inherited? Yes, Jagdish. Like whatever you're follow, whatever the checklist that you're following as of now, with any kind of frequency that can be inherited into our software. So Jagdish, can I ask a quick question? How we are maintaining the data as of now? We are using Excel, or like you are already having a CMS with you? Great. So Jagdish said like he already having a CMS with him. So yes, Jagdish, like in our CMS system, like we have this bulk upload option where all your data can be inherited very easily. Thousands of data can be pulled into the software with a single shot. So we have another question here. Will your system provide our team with ability to create a chain of approvals? Yes, Ms. Emma, like a multiple level of, so whatever the hierarchy that you are following as of now. So for an example, if the work order is completed, it has to be approved by the line manager. Then it has to be approved by the supervisor. Then it has to approved by the head of the department. In that case, like multiple level of approvals can be created here, and you can give the access accordingly into the our software. So we have another question from Jagdish. Schedule inheritance to group of an equipments in the inventory. Yes, Mr. Jagdish, that can be done in our CMS that you can do it. So after this call, like I'll call you back. Please share your contact details with us. So I'll call you back and I'll explain you like in detail like how the schedules can be inherited into the software. So we have so how the data, so we have a question from Mr. Dinesh, how the data backup is taken care. So Mr. Dinesh, like actually we are giving this particular software in two flavors. One is like CMS and another one is on-premises model or enterprise model, where in the SaaS model, like all the So you can use the software on the subscription basis, and if you are using an on-premises model where all the data will be hosted in your server, so you can use the either options to do it. And if for the data backup, like for an example, after a year of after a year, like if you want to terminate a contract with us, then all your data will be given to you in exported in Excel, and we'll be submitting it to you. So we have a question from Ali. So as per the frequency of MEP vendors violating the AMCs, not attending in time, no spare available in market. Again, a new material compatibility approvals with the existing. So yes, Mr. Ali, like I understand your query. So yes, in our system we have multiple approval sections, and we can also set it up an SLAs. So based on the SLAs, if they are violating any SLAs, that reminders and escalations all can be set it up here. So it will be automatically escalated to the concerned person. So, so Mr. Ali wants my name and contact. Yes. Thanks for sharing, Mr. Yadav. So, Mr. Ali, that's my contact number. You can contact me at any time. So we have another question here. How can I generate a report? Do you have the options in your application whether I can download it from my end? Yes, definitely. So we have multiple filter options and multiple report option is available here. So you can select the Require report. You can filter the data according to your need, and you can export it in either Excel or PDF at any time. You can do it. Team, you have any other questions? You're welcome, Hema. So you have any other questions, team? Who are the typical users? Okay. So it's a good question. Thanks, Jeremy. Like, thanks for asking this question. So in our CMS, the person who are considered as an users, or the person who is assigning the work order, and the person who is going to execute the work order, they both are considered as an users here. And if you're a person like who is going to only raise the ticket, then you are considered as an free users in our application. I hope I have answered your question. Yes, Ms. Jami, you have any other questions? All good. Thank you. Perfect. Thanks, Jami. Thanks for your response. So, yeah, any other questions? Okay, perfect. So if you have any other questions, like you can feel free to contact me at it any time. What you're seeing in the screen, that is my number. My name is Muthu. So feel free to contact me at any time. So if you don't have any other questions, like let's end up the seminar here. I really appreciate all your time in joining this call on your busy schedule. So thanks. Thank you very much for your time.